Hey Tanya, my name's Kevin. Today we're going to be doing your orientation to our IOP program. Um, so we're going to go over some things you need to know, some rules and guidelines in order for you to remain compliant with our program. Um, First off, IOP is 3 nights a week, Monday, Wednesday, and Thursday from 5:30 to 8:30. And we do ask that you attend all 3 sessions a week. If you're sick or something crazy comes up, we can work with that. We do ask that you bring in doctor's notes or any documentation stating why you're absent. Um, so what we're going to go over right here in the outpatient program handbook is just some things that describe our program, what it is, what we expect from you. Um, we do expect confidentiality. What we talk about in here stays in here. Obviously, we don't take anything outside of our treatment. Okay. Also, we require you to attend 3 outside meetings a week. One of those can be a church service, but the other 2 need to be either Alcoholics Anonymous or Narcotics Anonymous. If you look on the other side of your folder, we'll get to in a minute, there's a meeting sheet that you take up there to get signed, and you'll turn those in on Thursday, and you'll get a new one on Thursday. So between Thursday and Thursday, you need to have at least 3 meetings, okay? Do you know why we require you to do that? It's so you can start to build a sober support network, to get a sponsor in AA, and to start being around people who are living this life instead of those old people, places, and things that draw you back into what you were doing. We do have the right to drug screen you whenever we want to, and we will, with or without suspicion. Because we all know that treatment isn't treatment without drug screens, right? So if something happens and you start to use, we know how hard it is to get honest, and we want to help you get honest the best we can, and sometimes that's what has to happen. A relapse, if you have a relapse, that does not mean you will be discharged from our program, but we may have you do a higher level of care, or we may, it's a case-by-case basis. We're here to help you. We're going to try to help you. After so many IOP sessions, we'll talk about stepping down to continuing care groups, which is only 1 hour a session for 3 days a week, and that's usually after around 18 sessions, depending on your progress. We expect you to dress respectfully and to be respectful to the counselors and the other group members. What you can expect from us is we're going to treat you with respect and dignity. We're going to set treatment goals and help you accomplish those. We're going to keep all your information confidential, and we're going to return your calls within 24 hours. Okay. We went over confidentiality. Went over some of the rules and guidelines. There's a paper here you can read on your own that talks about making your treatment more successful. And medications. So there's medications that you cannot take in here. Any controlled substance. If one is prescribed, we need to go over that with our doctor. But I know you don't have any controlled medications prescribed, and we're going to keep it that way. Any medication that says DM on it, dextromethorphan, you cannot take. And alcohol labs do tests for alcohol, so any things like NyQuil that contain alcohol are no-goes as well. And there's a complete list right here that you can go over. And so then we're going to go over here to the next page, Tanya, that we talked about. This is our self-help meeting verification sheet. This is what you're going to take the meetings to get signed. Like I said, we require 3 a week. 1 can be church. And if you go to church, just have the usher or some staff member at the church sign it saying you were there, okay? Mm-hmm. We do offer peer support here. Mm-hmm. These are people that help you with everything a therapist does as far as getting to meetings, finding a sponsor, making a budget, things of that nature. So that information's right here, and you can go over that. They have their phone numbers in here, so you can call them after hours, and they'll answer the phone, and they'll return your call. And also right here, we have a list of all AA and NA meetings in the area. So you can always find a meeting. There's pretty much from 7 in the morning to 11 at night, there's meetings all over the city. So you can go through that and find a meeting as well. Do you have any questions for me?
I don't think so. What about like if you have an antidepressant or something? Do y'all let people take things like that?
On occasionally, our doctor will prescribe SSRIs, or if you're already getting one, we can go over that with our doctor, but yes, we do.
No, I don't think I have any questions.
Awesome, Tanya. Well, we look forward to seeing you tomorrow.
Thank you.
Thank you.